טבורית, בנק הדם הטבורי, כי הטבור הוא חיבור לחיים.
Clinical trials that you are running now is a little bit out of the traditional taking care of cord blood. Cord blood was for bone marrow. And now you found other areas like CP and going on to autism.
Right.
Can you tell us about it a little bit and how the idea came into your mind?
Well, originally the idea of using cord blood came from work in bone marrow where you needed cells to replace the bone marrow or the blood system after a patient was treated with radiation or chemotherapy that damaged their bone marrow forever. And that treatment was originally used for patients with leukemia and other cancers. But then we learned that getting donor cells when you have cancer is helpful to prevent the cancer from coming back or relapsing. And as more and more people needed donors, we realized not everyone will have a match, either in their family or even with millions of volunteers in the registry. There's not enough to ever find a donor for everyone. And cord blood is more tolerant of a new person than bone marrow is, so the idea came to use it without fully matching. And that opened up the possibility that every patient who needed a donor for treatment of leukemia or other genetic diseases could have a donor with cord blood. And in my work, we treated children with a disease called leukodystrophy, which is a genetic disease that affects the development of the brain and causes children to die early in life. And we used cord blood as a donor for those children and learned that it was making their disease better, or was a better treatment for their disease than bone marrow cells. And we also learned that after a transplant, the cells went to the brain and engrafted in the brain. And from that idea, we thought, well, maybe when a child has an injury to the brain, we could use their own cord blood to treat and help the brain get better. And that's how we got to treating CP and how we're starting treatment in diseases like autism.
And how do you see the results?
So we have encouraging results in CP and also in babies with what's called HIE, or hypoxic ischemic encephalopathy, which is a rare problem when babies don't have enough oxygen around the time of birth, but is very serious and causes serious brain disorders. In both those situations, we see very promising results when we give the baby their own cord blood, or an older child with cerebral palsy their own cord blood. And we also learned in experimental models that the cord blood cells make substances that signal other cells in the brain to repair the brain. And it helps repair connections that may be damaged in the brain in CP and HIE. And now we think, because autism is also a disease where connections in the brain can be abnormal, that it may help children with autism.
So I'm not a doctor, but I'm a father and now I'm a grandfather. This is a wow.
Yeah.
This is really something that changed the way medicine will look at patients like that, because I understand CP doesn't have other kind of cure.
Yeah, that is true. There is no cure for CP today. I think in general in medicine, we've exhausted easy things that can be done with drugs. But cells are smarter than drugs, and they're like intelligent drug factories. And they can go and make the right chemical that's needed for a given problem.
And what is the future about autism? Because there are much more numbers of autism compared to CP.
Yeah.
And the levels of autism, if I understand. So
it appears that the number of children diagnosed with autism each year is increasing, although the reason for that is not understood. And again, there is no treatment for autism right now. Some people think that autism is a problem in the brain where the connections are not working properly. And we know that cord blood cells make chemicals that can help those connections normalize. So we're hoping cord blood can help children with autism, but we're studying that now to learn whether that's true or not.
When you say that children improve, what does it mean? Did they start walking? Did they start hearing?
In general, in our study, we've had children who could not walk who did then become able to walk by themselves. We had children who had had strokes in utero and then got cord blood infusions, and you know, because of the stroke, they couldn't use one side of the body or couldn't use their hand and arm. And then a year later, they were able to use those extremities. We had some children who had difficulty with speaking, who started to be able to talk normally. So it was a variety of different responses, and sometimes it was improvement, and sometimes it was, you know, a situation where they gained full function back. It was many different levels of change.
טבורית, בנק הדם הטבורי, כי הטבור הוא חיבור לחיים.